Hello everyone, I'm Dua, consultant clinical psychologist, hypnotherapist, and NLP practitioner and OCD specialist. So today we'll be discussing and we're going to explore two unsettling but very real experiences, derealization and depersonalization. Okay, many people wonder why does this happen and is this just anxiety and what's the connection with trauma or depression? So if I would just wanna clear all of the facts and all of the real things that would help you to overcome that. Okay, so if they find this helpful, hit the like now and subscribe for more trauma recovery and mind body resilience tools. Now let's begin. What are derealization and depersonalization? First of all, let's define our terms clearly. Depersonalization is the feeling of being detached from your body, thoughts, or feeling, as though you are watching yourself from the outside. And the realization is a feeling that from your surroundings you are unreal. You dream like foggy, detached, things look strange, and you might feel like you are in a movie. These aren't just metaphors. Many people describe them as everything feels flat. I feel like a ghost in my own life. I'm here, but I'm not here. So importantly, you genuinely know that these feelings are odd. You are not actually floating outside your body with experiences persist and cause distress. And the short episodes of these sensations may happen for many people during extreme stress, panic, or exhaustion. But when they become frequent, persistent, or deeply disturbing, we start to talk about a condition pattern of depersonalization or derealization disorder. According to the research, depersonalization, derealization is more likely in people who have experienced trauma, anxiety disorders, depression, and chronic stress. So now you have a baseline what these terms mean and what they are relevant. Let's move into how trauma, anxiety, and depression link in. So now let's talk about trauma. Trauma is one of the strongest link with DPDR. For example, one study found that childhood interpersonal trauma, especially emotional abuse, was highly predictive of depersonalization disorder. Worse, in the context of PTSD, there is a dissociative subtype, in which element of which is DPDR, which is found up to 12 to 50% of PTSD cases. Why might this happen is trauma overloads the system. When fight and flight and freeze responses are triggered, the brain may respond by disassociating and stepping out of the body and stepping out of the moment as a survival response. So, for many people, DPDR presents a protective mechanism. Turned chronic, if the world becomes too painful, I'll disconnect, and then it becomes its own trouble. Now, what's the link between anxiety and DPDR? Anxiety plays a large role too. High anxiety, panic attacks, and chronic worry increase the likelihood of dissociative feelings. One study found that in patients with vestibular issues can lead to more frequent and more severe depersonalization, derealization systems. Okay, and in broader sense, when your nervous system is in high alert, when you feel loss of control and you feel what's happening to your body, DPTR may emerge as a defense. I'll detach, so I don't feel the fear fully. So anxiety can trigger the DPTR. Can you feel anxiety? You worry. Why I'm feel unreal? What becomes another stress loop, and then the depression link. Depression is another frequent companion, and the research shows that in people with depression, if they also have DPDR symptoms, their outcome are worse, and the risk of persistence of depression doubles. Remission rates are really low. Why is it? Because in depression, you often feel numb, disconnected, and the world loses color. That's is very similar to DPDR. The self loses its vital connection and the world loses coherence. So when trauma, anxiety, and depression come together, DPDR may be central piece of the puzzle, not an extra symptom, but a more core feature of the experience for many. Now let's look into what mechanisms underlie DPDR, and understanding these help us see why the experience is happening and how to work with it. In trauma, survival system reacts the dissociative subtype of PTSD. You may see brain pattern of increased prefrontal inhibition of limbic emotion areas, which is thought to relate to depersonalization derealization. In simpler terms, your brain dims emotional input and detach you from the body and mind. So you don't have to feel full intense. When it becomes chronic, you experience ongoing detachment rather than just short escape. And cognitive and perceptual factors, you may hold beliefs like I'm not real, this world is fake, and I'm outside of myself. You might monitor your body intensely, feel disconnected, and feel your body sensations don't match your mind. Research suggests that difficulties integrating introspective bodily signals and extroceptive environmental signals also plays a role. As when you avoid emotions or we disconnect is the right trauma, it reduces emotional processing that can lead to numbness, alienation, and increased DPTR. Early attachment disruption, neglect, and emotional abuse impair forming a stable sense of self in the self safe body mind integration. One review says this association is strongly correlated with trauma and attachment disruptions. Social association, chronic stress, and lack of somatic grounding build the conditions to DPDR to become persistent. Recognizing the signs and want to help. The signs and patterns are feelings of my body is not my mine. I'm watching myself. The world around you seems distant, dreamlike, and unreal. Emotional numbness, disconnection from self and others, feeling detached after trauma or during anxiety, panic, and low mood. These experiences may come and go, but if they persist, they interfere with life. So, professional help. These feelings are frequent and long lasting. They cause distress or interfere with work, relationships, and daily life. You also have trauma history, anxiety, depression, self harm thoughts. So, you guys can contact me anytime for therapy. I'm always available for you. Now, practical coping strategies and skills. Now, let's move to what you guys can do is grounding, grounding, and embodiment. Okay, when you feel detached, try the 5, 4, 3, 2, 1 sensory grounding. 5 things that you guys can see, 4 things you can hear, 3 things that you can feel, 2 things that you can smell or imagine, or 1 thing that you can taste or you can imagine that. Okay, place your feet firmly on the ground, notice weight, press palms, wiggle toes, feel texture of the chair or floor. These actions reconnect you to the body environment and disrupting this associative loop. Then cognitive emotional work. Write down what you feel when you detach. I feel unreal and I'm watching myself. And the challenge is this always true? What evidence says I'm present? What small parts of me feel connected right now? Create a statement. I'm here. I'm present. My body is mine. When you feel it, anchor it. With touch your wrist, you can hold hand to chest. Over time, you build a new habituated link that is body plus I am present. Okay? And address underlying trauma, anxiety, and depression. If you have trauma history, consider trauma informed therapy like EMDR, CBT, somatic therapies. You can also connect with me, and I'll provide you hypnosis and NLP too. And these sessions are also really essential, and that works instantly for the clients and those who have experienced trauma, because it works really well. It also depends on the psychologist at how what's the way which approach they are using. So it varies from individual to individual. Okay. Everybody's needs wants are different, so I modify my techniques according to the client story. For anxiety, use breathing. Okay, inhale for 4, hold for 1, and exhale for 6. Like inhale 1, 2, 3, 4. Hold for 1. For 1 second, you have to hold it. Now exhale 1, 2, 3, 4, 5, 6. Now exhale. Okay. Schedule a worry time and exposure to fear sensation in safe context. For depression, activity scheduling, social connection, meaning focused tasks, support networks, since DPDR is often intertwined with these, and treating them helps reduce the attachment. Create a presence routine before bed upon waking. 1 minute check in with your body. Where am I feeling contact? What sensations are present? Set a reminder in day once every 2 to 3 hours. Pause for 20 seconds and feel your feet, breathe, sense environment. These micro practices help your system learn presence again. Okay. Now, if you find this video helpful, please like and subscribe so you'll get notified when you post more on resilience, trauma recovery, mind body integration, depersonalization, derealization. I'll also try post like some hypnosis sessions that will help you too. So you guys can connect with me if you guys need one-on-one sessions. I'll provide you too. Don't feel that you guys are alone. I'm always here for you. You guys can connect with me anytime. Okay, in the comments below. Just let me know what is the one small thing, a small grounding or presence step you guys will try today, and I'll be reading and would love to hear from you. You are not alone in feeling detached. You can come back to yourself in your world. Okay, a lot of my clients have recover, so don't worry at all. Okay, thank you for watching. Take good care of yourself, and I'll see you next time. Till then, take care and goodbye.